All right, happy post-op appointment.
If you're getting this video, you've already met us.
All right, so you know me, I'm Dan, and I'm sure you've definitely met Nicole. Nicole is our nurse practitioner, and most likely she was there for your pre-op appointment. She was almost certainly there for your surgery to help me with the procedure, and then afterwards for the post-op appointment. So this video is now about Nicole.
Oh.
And Nicole,
Yes.
tell us, what can you help our patients with after their surgery?
Yeah, so my favorite post-op treatments, number one is always Botox. After about 6 weeks after your surgery, Botox is my favorite, 100%. Also, some fillers are some nice. We're super conservative here, as we are with your eyelid surgeries. We're super conservative with your fillers. You should look natural, age appropriate, but it is like a nice touch.
Yeah, so Botox, like you said, 6 weeks. Where can you do Botox? Where are the common places?
The most common places are the 11 lines and the smile lines. Those are most popular. Some people like to do their little bunny lines here, their mentalis here, and then some people like to do these upper lines up here as well.
Great. Last place is what you're going to be doing for me. Nicole does my Botox, and she does fillers for my mom. So you can also do Botox for...
Oh, how could I forget? My favorite summer treatment, Botox to the armpits for hyperhidrosis, or just if you sweat a little bit more than you're liking.
Yeah, so it turns off the sweating for armpits, which is great. It's like the easiest thing in the world, too.
Yeah.
Then fillers, where do we usually put fillers?
Oftentimes, patients just need a little bit of filler in their nasolabial folds around their oral region. Some patients lose a little bit of volume into their cheeks, so that's also a good option, but it's totally patient dependent.
Yeah, Nicole does fillers on she does my Botox and she does my mom's fillers.
Yeah.
So, you know, I always think like, especially like 45, 50 plus is like pretty common to have like kind of deep, these are called nasolabial folds. And that's like a really nice kind of like just like icing on the cake, kind of like finishing touch treatment for like a blepharoplasty. Like she said, and I think you get the picture from being in the office, that we're very conservative with these treatments, so not to be overdone like a lot of patients are worried about.
Yeah.
Then we also have a bunch of cool devices. So what do you have in stock for that?
For your skin, the best thing is the RF microneedling. Dr. Lamman does CO2 to the face, but I love RF microneedling. You can add on PRP, where we draw your blood, spin it, and pull out all those good platelets. It gives you like a nice mask afterwards. Cool. Also, those little veins around your nose, those are so easy. Those take just a minute.
Okay, so then for RF microneedling, hard to pronounce, what are the best patients for it, and what should they expect, like what patients like need it and what should they get out of it?
Yeah, so the best candidate for RF microneedling is patients that are just losing a little bit of collagen and elastin underneath their skin. The needles get underneath, they stimulate, cause like a little bit of controlled trauma underneath the skin, so that your body has to produce elastin and collagen and all of that good stuff to help heal itself from underneath. It gives you a super nice glow, it tightens up the skin a little bit, and patients love it.
Cool. What's the downtime for that?
24 hours, not even.
Cool. And then the other thing she was talking about is something called YAG laser, where I get them too. People get like little squirrely looking red blood vessels, kind of most commonly like around their nose or on their cheeks, their chin. Those are awesome. I'm jealous that you do it because it's like so fun to just like zap them and they're like erased. It's like instantaneously gratifying, which is amazing.
And then fall and winter is intense pulse light therapy is amazing for fall and winter. For all of those summer spots, we kind of gotten a little bit dark. Any type of rosacea, it targets all of that. So that's a really nice laser as well.
Yeah, so that one's called intense pulse light, or IPL. And people who have like kind of reddish cheeks or a little, so any like reddish cheeks, forehead, nose, it just kind of turns down the redness.
Yeah.
Same with the like light little brown spots that people get, like little summer freckles. Yeah. It helps with that. It doesn't, people like have some brown spots that like cannot be erased, but the ones that kind of come up in the summer, it works really well to kind of like get rid of those pretty quickly.
Yep. And then the best treatment of all is cool sculpting.
Yes. So Nicole did my cool sculpting. Yeah. That was awesome. what is cool sculpting?
Yeah.
Like, who are good candidates for cool sculpting? What should they get out of that?
Yeah, so cool sculpting reduces your fat by 25% each treatment. Most patients start with their abdomen and their flank area. Each treatment's a 25% reduction. So it targets the fat by freezing it, and then actually you pee it out.
It's like the best thing ever.
Yeah.
So Nicole did that for me when we first bought the cool sculpting machine. I was the first patient, and I'm doing my next one next week.
Yeah.
So you can see the before and after from the first treatment on Instagram. It's pretty amazing. Great. So we are here to help. Thank you for being our patient, and we have so much more to offer. Those are the things that Nicole does. The other one or two things that I do that we probably didn't do during your surgery is CO2 laser resurfacing. So that is for people with like a lot of like little fine lines and wrinkles. It works really well for that. Yeah. But if you're interested in any of those things, we're here to help. And just let us know. Call or talk to Melissa or Joanna, and we'll talk to you soon.
Yeah.
Thanks.
Bye.